So let's look at some significant factors. So these are the big risks. We've got force, we have repetition, and posture. So these are all interrelated and are associated with increased risk of injury. So force is the amount of force that can be exerted. It also depends upon your posture. So for example, when the hand is flexed or extended, deviated ulnarly or radially, the power grip force is only 65% of what can be generated when the hand is in a neutral position. So it also requires more force to grasp a slender diameter pen than one with a larger diameter. So we're going to look at our instruments. There are older instruments that may be smaller in diameter compared to the instruments that you all have in your cassettes that are going to be a larger diameter, which is going to allow us to not have to hold or pinch our handles quite as tightly. So we have repetition. So the great multiplier. So a lot of what we do is repetition, patient after patient, we're doing the same thing. So this repeated performance increases our risks, especially when a great deal of force is required. So if we're seeing patients that have a lot of calculus and need lots of deep cleanings all day long, that's going to be pretty that's going to really affect your hands and your body when you're doing something like that. So there really needs to be pauses and breaks, and you can adjust your schedule as needed and let your office know that perhaps you only want to do something that's going to be a little more physical or exert more energy every day rather than having it all in one day. So these pauses and breaks is really important for recovery because you can become fatigued, and we want to make sure that we're able to have some time to repair any micro trauma that we may have created due to that repetition. So posture, so there's a neutral zone of movement for every articulating joint in our body. So the range of motion is defined by movements that do not require high muscular force or cause any undue discomfort. So injury risks increase when work requires a person to perform tasks with body segments outside of their neutral range in a deviated posture. So if we are holding our shoulders up, for example, all the time, we're going to start to get sore. Or if we hold our arms out in front of us for a long period of time, our body is going to start to, compensate and try to maintain that. And that's not something normal for our body. So we really want to make sure that we're, staying in that neutral range. So what is that neutral range? Or our neutral posture? So appendages, which is like our arms and our legs, anything that's coming out of our body, they need to neither be away nor toward the body's midline. So they need to be in a neutral place where they're not too far out or not too tight in. So shoulders are not abducted, overextended, or hunched. Our trunk is not flexed forward or extended backwards, twisted, or laterally bent. When seated, our buttocks or our bottoms, our thighs, our legs are all evenly supported in our chair. Arches behind the knees are open for free circulation. The lumbar region is also supported. You guys got to know a little bit about the operator chair last week, and you can see how our chair is designed where it will support all of these parts of our bodies while we're seated. So what is neutral posture or positioning? So let's look at some examples of what neutral posture looks like. So when we're sitting, you'll see that the back of the chair is supporting the lumbar region of this person. Their bottom is all the way back in the back of the chair. The space behind the knees is open and not being pinched or closed or bent too tightly. The feet are flat on the floor. So it's really important when we're in an operator chair that the bottom of the chair has the 5 casters, so really gives us some good support. The height, so the height of the chair should be able to be adjusted, and our thighs can be parallel to the floor or just slightly elevated or just slightly pointed downwards, or the knees below that level of the hips. So at least one foot should always be flat on the floor for stability. And I'm going to say in our clinic, both of your feet should always be flat on the floor for stability. Legs should be apart to form a tripod, and that will help again for stability. So this image is an image of an operator that's out of balance. So take a look at it and think about the things that may be out of balance here. So you'll notice that the operator is sitting on the edge of the chair. So this can be really dangerous. The chair can slip out from under you. So there really isn't an easy way to get lumbar support in this position. Also, the operator is leaning pretty far forward, and the neck is bent a little bit too far than we would want it to be. In this picture, we're going to take a look at the operator's arms and shoulders. So do you think that this is a neutral position or anything close to it? I would say no, because those arms are really high up, where we've got those chicken wings out, and that's causing our shoulders to also go up. So you want to really avoid bringing your arms up in that manner. So you want to keep them to your side or just slightly away from your body. So we're looking at the head and the neck. So we really want to be in a position where our head and the patient's head are about 15 inches away. That's a really good working distance, and we don't want to have more than that. And we don't want to have any less than that. We don't want to have to lean forward or rotate from the hip to be able to see in our patient's mouth. So you want to make sure that you're keeping your head erect and upright and only slightly bent forward. So keeping that proper distance from the work field really saves your neck and your upper back from any strain. You can use the microscope loops, which are the glasses, and it's really important to get an eye exam, make sure that you can see okay, and if you need any sort of glasses or prescription to enhance your vision, that's going to be a really good thing to do so that you're not straining your eyes. In this picture, we have the clinician to patient relationship. You can see the operator is sitting next to the patient. She's putting her arm across her waist, and she's using her elbow and measuring it to the patient's open mouth. Now, this is going to be an ideal position for your patient to be in. So you shouldn't have your elbows raised above the waist level, and you want to make sure that your lower arms should be horizontal, raised just slightly. The angle between lower and upper arms is slightly less than 90 degrees. Your shoulders are level, not hunched or hiked up towards your ears when you're trying to establish this clinician to patient relationship. So do you think that the patient is at a proper height for the clinician in this image? No, the patient is actually too high. And the reason why we know this patient is too high is because the elbow is hiked up. So you really, if that patient, the chair would come down a little bit, that would allow the clinician's arm to come down, and then she would be able to be in that neutral position. So our hand and our wrist. So there's two types of wrist placement. So you can see here, wrist flexion is when the hand is pointed down. You really want to avoid any type of wrist flexion. You want to try to keep your hands as level as possible. Wrist extension, that's when we're bringing our fingers up and we're extending. You really want to try and avoid doing a lot of that as well, because you'll really start to feel it in your wrist and in your arms. So ulnar deviation, so that's when our hand is pointed, like, so our palm is like pointed towards us. So we're kind of like in a cutting motion or axe motion. But when we're pointing our fingers down, and you can really feel it if you're trying it now, you can feel those muscles, straining or stretching. That's going to be ulnar deviation. Now, when we do the radial deviation, we're going to be pushing our wrist in that backwards position. So our thumb is actually going to be pointed up. So just to clarify there, I think I said that incorrectly. So ulnar deviation, your pinky is going to be going down or kind of pointed down. And then the radial deviation, your thumb is going to be kind of going in the upward position, going up. Good. Alrighty. So what do you think about these pictures? Is there some wrist flexion going on? Maybe some radial deviation? So if this clinician is doing this all day, every day, they're going to eventually, if not already, experience some sort of trauma within their hand and their wrist. Here are some examples of wrist extension. So wrist positions are extremely important. Remember what was said earlier. So when the hand is flexed or extended, radially or ulnarly deviated, the power grip force is only about 65% of what can be generated when the hand is in a neutral position. So if your wrist is out of position, you're not going to have enough power or enough force to be able to accomplish what you're wanting to accomplish when you're cleaning your patient's teeth. So this will become more significant to you when you begin to exert the force necessary to remove that calculus. So let's look at grasp a little bit here. So when we're learning grasp and we are practicing with our patients and our instruments, we sometimes tend to hold the instrument really tight. So we can experience some extreme hyperextension. So you can see in the image on the left, that thumb is hyperextended. And then in the image on the right, we can see some moderate hyperextension where we've got a little bit of that pinching going on. So these positions increase compression and shearing stresses to the joint at the base of the thumb. The stability of the joints are comprised over time by forces which elongate those ligaments. So let's look at the grasp a little bit here. So you can see in the image that the wrist is aligned with the lower arm. The palm is open and relaxed. We have a nice light pressure against the handle. Our index finger and thumb are held in a rounded shape, so we want to create that soft C position. So there is some controversy about the position of the little or pinky finger. So we talked a little bit about that during lecture. You know, in the Wilkins textbook, it's said to keep the pinky in line with the other, with the ring finger, so position next to that ring finger. But some ergonomic analysis of this position has revealed that when the little finger is down against the ring finger and against the rest of the hand, the hypothenar eminence is tight. So that, which helps to stabilize the hand by contracting all of the little muscles under the finger. So unfortunately, having a little finger in this position can raise the pressure in the palm and carpal tunnel by isometric contraction. So by tightening up the extensor instead of the hypothenar eminence, we also stabilize that side of the hand. But since this muscle runs along the back of the hand and not through the palm, it will not increase pressure in the palm or the carpal tunnel. So if you feel comfortable with letting that pinky go, you want to drink tea or drink some wine and let that pinky out, you are more than welcome to do that. Or you can keep it in. It's really just however you're comfortable. So risk reduction. So we really want to limit reaching, limit bending, limit twisting. So the position of our equipment is really important. We want to position our delivery system, our operator stool, patient chair, in order to limit that reaching, bending, and using extreme positions.